What's up?
What's up?
Hey, I'm your boy MC Hollywood.
And it's J Flash. And welcome to Sickle Cell Talk.
That's right. Welcome to another episode of Sickle Cell Talk. What? You move over. Why you gotta be all up under me, man?
Well, because we have a surprise.
This is not our studio.
But we have a surprise.
What's the surprise?
How about you introduce it and we'll see.
All right, guys. First of all, we just want to thank everybody for tuning in and watching our channel. And thank you for sharing all our videos and liking it and subscribing. We appreciate it so much. And also, we want to take an opportunity to give a shout out to the boss lady, Mom, our producer. So shout out to Mom. So today we have a special treat for you. As you can see, we're not in our studio today. So, as you know, we are a firm believer in alternative medicine when it comes to sickle cell and the way we treat sickle cell with JAYFLASH'S situation. So, one of the things that we've been doing for the past for the past year is that we've been, JAYFLASH has been coming to therapy.
Drum roll. Oh my.
What? You want to
I was going to do drum roll.
All right. Anyways, JAYFLASH has been coming to therapy.
Drum roll. Oh.
Okay,
Dad.
let's try it again. Okay,
Dad,
okay. So JAYFLASH has been coming to
drum roll, please. Therapy.
Therapy. That's
For
right.
the third time in a row because of somebody sitting on my leg.
Anyways, so today we are happy, we are grateful that his therapist actually agreed to join us on the show. So he's actually going to be our first guest on Sickle Cell Talk. All right, so ladies and gentlemen, it is our pleasure to introduce Mr.
Jeff.
All right, going down, Jeff.
All right.
Very dramatic.
I know that wasn't very dramatic, Flash. I'm sorry about that, but did the best I could.
Hey, Jeff, how are you?
Good. How you doing?
Good. Well, we just want to thank you for very much for accepting the invite to be on our show today. So basically, we just have a few questions we want to talk to you about, and especially as it relates to JAYFLASH'S situation. So we again want to thank you for inviting us to your office and allowing us to do this. So we really appreciate it.
Oh, it's my pleasure,
So
my
Daddy,
honor.
where's the questions?
Well, don't worry about the questions, all right?
Did you shove them in the crack?
So, Jeff, no, I did not. So, Jeff, why don't you tell us a little bit about your background and and your experience?
We're not the po-po. We want your background information. So
Dude.
Priors, so you're in the system.
Can you let the man talk?
Okay, all right,
All right. So currently I'm working for a private practice. We do Christian counseling. I've been with them for about 10 years, and then prior to that, I was doing other work in the field for about 13 years. So it's been 23 altogether. But like I said, the past 10 with this particular practice, and so as both a counselor and a person of faith, it was really important to me to be situated in a place like this. So.
That's awesome, and that was one of the most important factor for us is your Christian background when they referred us to you. So, do you typically deal with children as your patient population, or?
It definitely varies. I'm comfortable working with really any age. So I see kids, teens, adults. I know obviously counselors are different. Some people have different specialties, and some people really prefer to work with one age or the other. I will say that in my practice, I'm one of the people that they tend to send kids to, just because I'm very, very comfortable working with kids. I like working with kids. So.
Yeah, I gotta say, JAYFLASH really likes coming here. He gets along with you very well, so he actually enjoys the therapy.
We both love Avengers.
So in your 10 years of experience, even before that, were you familiar with sickle cell prior to meeting JAYFLASH?
So it's funny you ask. I mean, certainly I knew what it was, but I didn't know anybody personally who had sickle cell until I met JAYFLASH. So yeah, so that was a new experience for me.
Nice.
Hey, let me ask a question.
Okay, sure. Ask a question.
How about patients with chronic illnesses?
Yep, definitely work. I mean, both currently and in the past, I've worked with people that have had chronic illnesses of various kinds. Yeah. But you're the first person that I've worked with specifically dealing with sickle cell.
Yeah. Okay. Third question. Do you use a different technique or approach with JAYFLASH as opposed to other patients?
Yes, but not because of the sickle cell. More because of your age, right? So
I gotta be, intrigued. I gotta be intrigued.
right, so it has nothing to do with the sickle cell, but obviously you work with people of different ages differently, right? So when you're working with somebody who's a little bit younger, and don't get me wrong, you are super smart and super mature, and you want me to keep going?
Yes.
No.
Good looking, and anyway. So no, you're obviously very smart kid, and tremendously funny, and so many fine
I
qualities.
think I get the funny part from one of my parents. I think it's my mom.
Yeah, I think it is well. Yeah,
Yeah.
absolutely. So speaking of chronic illness,
Yes.
right? How important is it for people with chronic illness to seek therapy? I mean, how does it help?
I think it's definitely, obviously every person is different, but it can be tremendously beneficial because, generally speaking, particularly for a young person, going through life, dealing with a chronic illness, something that, say, other people in the general population may not deal with, it's stressful. There's certainly stress associated with that. There can be, in some people, there can be feelings of depression, right? Coping with, depending on what the illness is, it might be painful. It might make you tired. You know what I mean? It could impact your ability to do things you want to do. So in some cases, it keeps kids from being able to go to school or participate in sports, or it really can impact your life significantly. So it can contribute to things like I said, depression, anxiety. It can be really difficult. So it can be beneficial to talk to somebody like myself, just to kind of learn how to express those feelings and what to do with them.
So based on that, I take it that you would recommend that for people who are dealing with like a chronic illness to seek counseling.
Generally speaking, yes. Obviously it's not for everyone, but generally, yes. I do think there's some benefit there.
Yeah.
Well, my turn.
Sure, go ahead.
So, what are your treatment goals?
My treatment goals? Well,
For you specifically.
Yes.
So for you specifically, right? So, because when I first met you, right, we did talk about the Avengers. I remember that distinctly, and we talked about Marvel in general.
Yeah.
And we discovered that you know an incredible amount about the MCU, which was pretty awesome. And I knew, some. So we were able to connect on that, and that was cool. But one of the things that I also noticed as I got to know you a little bit was that there are certain things that you're less comfortable talking about, right? So sometimes when I might bring up a topic that's a little more uncomfortable or a little more personal, right, that might be a little more difficult to talk about.
Yeah.
So one of my goals would be to help you to feel comfortable talking about those things, right? Some of the stuff that's kind of like beneath the surface, that's stuff that probably don't want to think about, probably don't want to deal with, right? But it's important to kind of acknowledge that it's there and it's real, right? And know what to do with that.
Yeah.
Does that make sense?
It does.
Okay.
Okay, my turn.
Wasn't it just your turn now?
I know, right? And so we JAYFLASH talked about techniques earlier, right? So there are times that I come here, you have the the blocks out. We have
Games.
you guys playing
Like
Connect
Mad
4.
Libs.
Oh, you were just playing Mad Libs
That you wanna play
earlier.
with us?
We were.
Right, that I want to play with. Yeah, so sometimes I sit here and I watch when I'm not sleeping, of course. I sit here.
When he's going like this.
No, that's not how I go. But anyways,
Yes, you do.
When I sit here and I observe the session, it's very it's very interesting how through playing with the blocks or playing with the games, you are able to get him to speak about certain things and kind of access certain area that he would not normally talk about. So to me, that's, I find that very, very impressive. So I'm guessing that's probably one of the techniques that you, I guess, throughout the years you've been using and are very familiar with it.
Absolutely, yeah. So like I was saying earlier, right? So the approach that you use with a given person depends somewhat on their age, right? So again, you're very mature, so it's nothing like there's anything wrong with you, right? But because you're on the younger side, right? Some people your age are not too comfortable just like kind of doing traditional counseling, right? Which is like, I sit in the chair, you sit here on the couch.
Oh no,
we
you
talk.
lay down on the couch.
Right.
And then,
No.
and you're like, well,
Nobody
Rob,
does that
I mean,
anymore.
it's just like, well, Doc, I mean, it's been going great, right? But like,
That was like 150 years ago.
always up in my face.
So, dealing with JAYFLASH, how has that, I guess, broadened your knowledge about sickle cell, and does it make you deal with him or talk to him differently, or your approach?
Well, absolutely. When I first met JAYFLASH, I definitely knew that I needed to educate myself, so I definitely put in a lot of time doing research because
He did his homework.
Yeah,
I did. Well, because it was important for me to understand what you were going through to the best, my best of my ability, right? So that I could be most helpful to you, right? Because if I had no idea what you were dealing with, right, or no idea what you were talking about when you said, "Oh, I had a pain crisis" or something, right?
Yeah.
Then it'd be pretty useless, right? I wouldn't be much good to you. So I needed to do some research and educate myself, and I did that, and that was very, very helpful because I then understood more of what it might be like to be in your shoes, right?
So do you have any other patients with sickle cell that you're treating right now?
Nope.
Oh.
I'm special.
Well, we all know
Of
that.
course, yeah. You are special.
Yes.
Any other questions for Jeff, for Mr. Jeff? So,
Would you recommend it for others dealing with similar cases?
I would. Yeah.
See, you didn't do that question. You
well,
said,
I saved it for you. Yeah, I saved it for you.
Yeah.
Yeah.
Just because I think it's helpful to be able to talk about what we're feeling, right?
Yeah, absolutely. And again, Jeff, we just want to express our how grateful we are for the fact that you're working with JAYFLASH and you've gone above and beyond to educate yourself about his situation and to be able to understand when he's talking about certain things, when he's talking about pain crisis, you're able to relate to that. And to the people who are listening to us or who are watching our show, as I said, unfortunately, we do have to administer opioid for the pain crisis or for his situation, but it's not one of the things that we're going to continue to practice because of the fact that there is a high percentage or there's a high chance of being addicted to those medications. So anything that we can do to I guess to substitute that, that's what we're gonna do, and that's one of the reasons that he's doing therapy, and he also does acupuncture once a week. So we try to find different ways or different avenues to deal with the pain. So Jeff, I don't know if you ever been on a YouTube show before.
No, I haven't. It's a new experience.
So,
yeah.
Right. So I guess
so handsome.
Oh my God.
I'm just saying, look at this picture.
Dude.
Look at this picture. I am so handsome.
Oh my God. Anyways.
Yes.
Our next session, we need to work on your self-esteem.
Yeah, exactly.
Yeah,
Yeah. His
yeah.
cockiness.
It's really-
Just like lower it down a little.
Right. Yeah, we need to work on that. But anyways, guys.
Hey,
so
maybe I could refer a kid to you. Maybe you could make his annoyingness level come down 100. So it's like 0 because he barks a lot.
all right,
A lot.
dude. Can we close the show now?
Okay, all right.
But
all right.
anyway, guys, we just want to thank Mr. Jeff Parent for being our first guest on Sickle Cell Talk.
First guest.
Just to give you a little bit of the insight on how he deals with JAYFLASH with his situation and dealing with sickle cell. So again, continue to like our videos and subscribe.
Oh, also,
Anyway.
down below in the comments.
Oh my God, dude!
Vote.
Can we
Who
close
is
the
better?
show?
MC Hollywood or J Flash?
Oh my God, dude! This is not a competition, okay?
Okay,
Anyway,
that's
guys,
Big Sickle
we
Cell
just
Talk.
want to thank you for tuning in, and don't forget to
Sickle Cell. Wait.
Oh, you gotta touch. No,
Alright,
you
so
gotta
teach
take
me
Just teach you how to do it.
Oh, okay.
No, so you go from the top like this.
Yep.
And then you go Sickle Cell
Slash.
Got it.
that leg button.
All right.
Alright,
Okay.
so bye everyone. Don't forget to Sickle Cell
Slash.
that like the subscribe button.
And
Don't
we're gonna
the
karate
kick
kick.
the notification bell, and we're
And
gonna
punch.
punch the like button to get notified. Well, that's the notification bell. You know what? That's enough for Saints for today. Goodbye, people. Have a nice
Alright,
day.
this
It's
is
been Sickle Cell
Hollywood,
Talk.
and this is
Let's see how
JAYFLASH.
Mr. Jeff is the dude,
Thanks for having me.
and we'll see you next time. Woo!